Welcome back to my YouTube channel. So this episode is a little bit unique, I would say, kasi first time kong gagawin to. Alam niyo naman siguro na on social media, I really take time and I try to answer most of the questions na tinatanong nyo on my social media pages. Pero naisip namin na yung iba kasi parang worth na pag-usapan in video format. So, my team and I picked a little over 10 questions na susubukan natin sagutin ngayon. So, tingnan natin. Yung iba dito, hindi ko pa nakita. And ngayon ko lang itatry sagutin. Yung iba naman nasagot ko na, pero sabi lang nila parang masyadong bitin daw yung sagot. Kasi di ba limited lang yung pwede natin i-type dun sa comment section in some social media platforms. So, let's start. Number 1 question. Doc, ask ko lang po, ilang months or years ang gamit po ng adapalene plus clindamycin gel po? Well, thank you for your question. Pero, normally kasi, yung adapalene, pwede siya lifetime. You don't really build tolerance to it. Wala naman siyang side effect if gamitin mo siya forever. Pero, syempre, when we give kasi certain medications, may reason kung ba tayo magte-take nito or ba't nagpapahid tayo ng mga ganito. So, ibig sabihin, pag na-address na yung concern mo, then it doesn't mean that you have to continue pa. Usually, pinapalitan na namin or kino-convert ka namin dun sa mga products na kailangan mo. Pero, dun tayo may problema sa clindamycin because clindamycin is an antibiotic. And actually, ngayon pa lang nga, nagkakaroon na tayo ng resistance sa clindamycin on patients with acne. Kasi, merong mga tao na ginagamit yung mga clindamycin toners and creams for 1 year, 2 years, and because it's an antibiotic, yung bacteria na tinatarget niya, they're able to build resistance to it pag matagal mo siyang ginagamit or ginagamit mo ng sobrang tagal. So, normally ako, if ever I would give adapalene and clindamycin, I don't really want my patients to use it more than 6 months. Also, if you really want to continue using clindamycin, dapat hinahaluan mo siya ng benzoyl peroxide. Dati, in the market, there was a combination product of clindamycin and benzoyl peroxide. But for some reason, it's not available anymore. Pero yun, because you do not develop tolerance to benzoyl peroxide or resistance kasi iba yung mechanism of action niya. So, yun yung sagot ko dun sa tanong na yun. Hindi pwedeng years yung clindamycin na tuloy-tuloy gamitin alone. Next question, Doc, ano pong vitamins ang makakapag-control sa hormonal acne? Thank you po. Well, thank you for your question ulit. Unfortunately, walang vitamins na makakapag-control ng hormonal acne. And I don't want to talk about hormonal acne in depth in this video because I have a lot of videos on that on my YouTube channel. Ano lang yon? I think it was either early last year or late the year prior. Pero please check it out. And explain ko doon what hormonal acne is, what available treatments are, and what other modalities we can offer to address that concern. But definitely, vitamins are not the solution for hormonal acne. Next question, Doc, can you make a separate video informative about sebderm or dandruff sa face and scalp na di nawawala and compare it to psoriasis? As much as I would want to make a video about this, hindi kasi siya same. Like, they might look similar, to a patient, pero hindi pala. So, I can give like brief information about what sebderm or dandruff is, but comparing it to psoriasis might be a slippery slope. Kasi ang ayaw natin is magsa-self-diagnose yung pasyente or kung meron man siyang sebderm, baka isipin niya para, oh no, I have psoriasis. So, for me, yung mga ganito, they are best left discussed in a doctor's clinic via proper consultation and assessment. So, yung mga naman, basic information about sebderm or dandruff, I can probably make a video about that, but not to compare it with psoriasis or other serious conditions. I'm sure you guys understand. Next, Doctora, thoughts on using an antioxidant supplement such as vitamin E and stinging nettle root, which help in preventing eczema flare-ups as they help in detoxifying liver. Heard this from foreign derma sa TikTok, TIA. Well, okay. When it comes to eczema kasi, yung mga conditions na meron naman tayong evidence-based and proven na treatments, I would really more stick to that rather than trying out supplements. Kasi when we're talking about skin conditions, kung yung pinaka nag-work talaga best are those that you apply directly on the skin. Doon mismo sa eczematous lesions. Anything you take orally, gets processed in the body, and there are no studies that show that whatever you take by mouth will go dun sa target area mo. So kung magte-take ka man ng vitamin E, I mean, it might be beneficial for the whole body, but it doesn't really mean that it will go to that part of your skin where the problem is. And yung mga stinging nettle root, I haven't really heard about it. Maybe you can enlighten me with what study that those dermas were talking about. And yung, because they detoxify the liver, parang sobrang layo niya sa eczema. Parang although liver is a part of the body, but if you look at the pathophysiology of eczemas, medyo malayo yung liver. And if the stinging nettle root supplement helps in detoxifying the liver, medyo ang dami niya pang kailangan pagdaanan para masabi natin na it will help your eczema. So again, for eczemas, I would recommend topical treatments and identifying what your causes or triggers are rather, and addressing that instead of like relying on supplements na wala naman talagang masyadong evidence with regards to treating eczemas. Next question, Doc, bakit po iniiwasan yung thyroid when using energy-based devices? Well, very good question. Actually, yung thyroid, nasa ilalim naman siya ng neck in this part. So, pag gumagawa tayo ng procedures, hindi naman natin siya directly matatamaan. But because it's right here and our thyroid is a very, very important organ in the body that regulates our hormones, we don't want to risk injuring it for fear of causing hormonal imbalances. So, syempre, ayaw natin ma-disrupt. Nagpapaganda ka lang, biglang mamaya magkaroon ka ng hormonal imbalances, diba? Ayaw natin nun. Plus, wala kasing studies that show na parang if you do laser treatments, if you do heat and stuff around this area, hindi makaka-affect dun sa underlying structures dito. So, because we are doctors and we always want to err on the side of caution, iniiwasan na natin siya. Pero, marami naman tayong pwedeng gawing treatments in this area that address the skin laxity and issues concerning the neck. Huwag lang siguro yung mga energy-based devices that deliver heat and might cause thermal or heat injury to this area. Next question. Doc, pa-request naman ng content, Horace of Nevus. Love you po. Ayan. So, it's actually Horace Nevus. It's also known as what we call abnom or acquired bilateral nevus of Ota. Kasi meron tayong nevus of Ota, which is something that is seen at birth. Yung makikita nyo yung mga may balat minsan dito, na parang medyo dark grayish, bluish. Sometimes it involves the sclera, yung mata. So, yung ganon, parang it's inborn. Pero yung Horace Nevus, you acquire it. Usually, bilateral siya dito sa cheeks. Tapos, it's something or somewhere in between brown to grayish. Parang grage. Alam niyo ba yung color na yun, yung grage? Because it's deeper in the dermis and it's usually secondary to sun exposure. So, yung ganon, hindi sila responsive to topical treatments. Normally, they are more responsive to lasers. Pero, kailangan mo ng several sessions to address them kasi medyo malalim siya. Next, Doc, is there a cure for uneven cheekbones? I have TMJ and I chew food on one side only. Bad habit, kaya tuloy mas prominent yung right side ko. Wait, are you talking about cheekbones or masseter? Kasi magkaiba yon. If you are more referring to yung pagnguya, dito yon. So that would be your masseter muscles and not the cheekbone. So if you have uneven masseter muscles, definitely yung pagnguya mo on one side is a factor kasi it's a muscle eh. So parang isipin mo na lang mas wino-workout mo yung isang muscle mo compared to the other side. So definitely botulinum toxin injections can help kasi ipa-paralyze niyo yung muscles mo here. So parehas na sila, pantay na sila. So ang mangyayari nun, yung muscle mo na mas ginagamit mo to chew, syempre hindi na siya mag-work, so liliit siya. But the problem lang with that is, this is not kasi your only chewing muscles. You also use your temporalis muscles when you chew. So, pwedeng mag-compensate siya kung mahilig ka talagang ngumuya on this side. So, baka naman medyo lumaki yun dito mo ng konti. So, yun lang. Best to discuss this with your dermatologist or your aesthetic practitioner para ma-assess ka ng mabuti. Kasi, baka naman meron pa silang other ma-recommend na treatment for that. But definitely, it can help. Doc Gaile, can you make a video po comparing tretinoin versus adapalene versus retinol versus retinal? Thank you. Okay, sige. So, gamitin yung kamay ko ha. The retinoid family, malaki sila. Yung how do I say it? Pinaka-mother is the tretinoin. So, it's also known as retinoic acid. When you apply tretinoin on the skin, it works right away. That's why it's irritating to some, di ba? Kasi paglagay mo, gumagana na siya. Ngayon, may mga tao na hindi nila kayang i-tolerate yung tretinoin. That's why we have other derivatives of retinoids. We have retinol, retinaldehyde, and then we have adapalene. So let's start first with retinol. Yung retinol, we recommend it to patients with sensitive skin or those who are intolerant to tretinoin. Kasi yung retinol, pag pinahid mo siya sa skin mo, it converts to retinaldehyde or retinal before it can convert to tretinoin. So retinol is here. Pag nilagay mo siya sa skin mo, nagko-convert siya to retinaldehyde, which then converts to tretinoin. So yung mga hindi makatolerate ng tretinoin, usually binibigay namin either retinol or retinaldehyde. Ngayon, yung tretinoin, it can do everything. Anti-aging, anti-pigmentation, collagen rejuvenation, anti-acne. Because nga, siya yung parang mother. It binds to all the receptors and tells our skin to do all of that. Retinaldehyde and retinol are more for anti-aging. So, yun yung parang main focus nila. They have some anti-acne effects, but normally, we like to prescribe it to patients who are acne-prone and who want anti-aging effects. Adapalene, on the other hand, is a different kind of retinoid. Ibang receptors yung binabindan niya, and we usually give it for those with acne. Again, ito yung binibigay namin dun sa mga may acne na hindi kayang matolerate yung tretinoin or ayaw ng tretinoin or gusto mag-apply in the morning because adapalene is medyo photostable compared to your tretinoin. So, kung meron kang acne, adapalene ka. It has a little bit of anti-aging effect pa rin but not so much. So, sana nasagot ko yung tanong mo. Doc Gaile, recommended mo po ba yung paglagay ng ice sa face everyday? Well, actually, it's not something that I recommend. Kasi, like kung sinasabi sa patients ko, before you do anything, kailangan tanongin mo yung sarili mo, bakit ko ba ito ginagawa? Anong magagawa nito sa akin? May benefit ba ako dito? So, let's talk about ice. Why do we put ice? Ginagawa namin yun na ako, after doing laser procedures, for example, like CO2 laser surfacing, or after I treat mga pigmentation sa patients, binibigyan ko sila ng ice roller or yung, alam mo yun, yung parang gel roller. Because yung ice, meron siyang anti-inflammatory effect sa skin. So, kinukool natin yung skin to cause vasoconstriction, to minimize inflammation, to give comfort to the patient after procedures. Pero kung gagamitin mo siya sa skin mo everyday, ano yung purpose niya? Okay, maybe you want to cause vasoconstriction or to decrease inflammation, pero temporary lang kasi siya. So, ang fear ko lang doon is sometimes when we put ice on the skin, makakakos pa siya ng dryness or even irritation if you don't really need it. So, parang for me, maybe if you want to decrease the puffiness of your eyes kasi you want to cause vasoconstriction, pwede. But like for skin health in general, it's not really something I recommend. So, yun. Sana nasagot natin yung tanong mo. Next question. Doc, hindi po ako pinalab ng doctor ko before isotretinoin and naglabasan po ngayon side effects like hilo, chest pains, etc. Ayaw ako paniwalaan kasi wala daw side effects si isotret, sabi niya. Well, okay, madaming points to ha. First of all, the more recent guidelines kasi when it comes to giving isotretinoin, yung guidelines nila is if you are giving low-dose isotretinoin to the patient who is or who seems to not have any risk factors like obesity, possible liver enzyme issues, or high cholesterol, the lab test is not anymore mandatory. Parang kung sa tingin mo, yung pasyente mo naman parang healthy living, wala naman high cholesterol. Of course, we find that out after interviewing yun. Siya pinatanong namin. Hindi na required talaga magpa-lab test. But if you're giving high dose, ano ba yung equivalent ng high dose? We compute it by weight kasi. Usually, high-dose isotretinoin is given to patients with severe acne. Yun talaga yung recommended mag-lab test. Okay. Pero yung mga nafe-feel mo na, ang hirap kasi magbigay ng opinion kasi hindi kita nakita. Pero kasi yung mga chest pains, they are not really common side effects of isotretinoin. Kasi isotretinoin is a vitamin A derivative. So, ang ginagawa talaga, the mechanism of action niya is to influence our sebaceous glands so that they do not become more active. So normally, yung mga ma-experience mo na signs and symptoms would be dryness of the lips, dryness of the eyes, mucosal membranes. In some patients, they experience acne flare, naglalabasan yung mga acne. I've seen patients na young, yung mga in the growing age pa who experience a little bit of back pain, sometimes headache. Pero I think na if these symptoms are persistent, really talk to your doctor about it. Have like an like maybe make a timeline and consult also other doctors. Kasi baka naman hindi siya related talaga dun sa pag-take mo ng isotretinoin. Baka naman meron ka ng other problems or other issues that are going on in your body. So for this, have a conversation with your derm, be open to him about everything and about how you feel. And maybe ask for referral dun sa doctor who can check your other symptoms like kilo and chest pains. Next, Doc, bakit po ba nagkakaroon ng warts, especially sa mukha? Hehe, thank you, Doc. Well, yung totoong warts, pag sinabi mo kasing wart, yung pagkakaintindi namin mga doktor, kulugo, in Tagalog. So, yung kulugo, yung tunay na kulugo they are caused by viruses. So, there are hundreds of strains of viruses found in the environment. Yung iba sa kanila, meron silang specific na gustong pinupuntahan or tinutubuan na part ng katawan, like minsan paa, minsan neck, ganyan. Pero, normally kasi, pag nagpa-facial ka, pupunta ka sa mga facial centers, ganyan, yung sinasabi nilang warts, hindi naman talaga siya yung talagang kulugo na viral na nakakahawa. Normally, when patients come to us, wanting to have their warts removed dun sa face, yung mga brown-brown, hindi talaga siya yung viral warts na nakakahawa. More often than not, they are what we call dermatosis papulosa nigrans, or in layman's term, sometimes called skin tags. So, hindi talaga siya yung nakakahawa na warts. And meron mga tao na genetically predisposed to developing them. They can be due to prolonged exposure to the sun, sometimes friction. So, yung mga ganito, pwede mo naman siyang ipatanggal, pero hindi naman kailangan, and hindi naman nakakahawa ito. Okay, next. Doc, tanong lang po. Okay ba gumamit ng derma roller? Dami ko nakikita dito sa TikTok na aakit akong gumamit para sa hair ko. Well, actually, okay naman gumamit ng microneedling device. Kasi we do it in the clinic. I have here a mechanical microneedling device. When I was a resident, I used to do the, manual mechanical microneedling, mga gadgets, ganyan. But now, we also have the RF microneedling. So, for me kasi yung issue dito is, tama ba yung paggamit mo? Magandang quality ba yung derm roller na mabibili mo? Malilinis mo ba siyang mabuti? Masustorbo ba siya ng mabuti at masisterilize mo ba siya ng ayos? Kasi, remember when we do that, syempre merong blood, merong, fluids from the skin, and every time you use that, a second or a third time, without proper cleaning and storage, you put yourself at risk for infection and possibly making your condition worse. So, yun lang naman yung worry ko. I have nothing against the practice of derma rolling, microneedling, or what, because we do it. But yun nga lang, baka naman mamaya, pag mali yung gamit mo, imbis na umayos yung mukha mo or hair or scalp mo, ay mapasama pa. So, for me, this is best done, I guess, under the guidance of a professional. Kasi kami here in the clinic, yung microneedling device namin, disposable yung tip. After one use, tinatapon na namin. Kasi kahit marunong man kami mag-store or magaling kami mag-store, it's always safer and more hygienic to always use a new tip. So, yun lang yung ko. But, if you're confident naman, alam mo, I have nothing against the practice of derma rolling. Tsaka pagdating pala sa hair, kailangan malaman mo muna kung beneficial ba yun sa'yo, yung derma rolling or not. Kasi, if your issue is androgenetic alopecia, it can help, but actually, it's not enough. Next. Kaya po ba i-correct ng glutadrip yung hyperpigmentation from PCOS po? Dati po kasi pantay ang kulay ko sa katawan until mag-PCOS po ako. Nag-darken po yung mga singit-singit ko, siko ko, etc. Well, actually, if you think na yung darkening mo is caused by your PCOS, which is really, really possible, addressing your main issue, which is your PCOS, will actually make all your problems improve and even disappear. So, kasi kahit gumamit ka ng kung ano-anong whitening creams or treatments or whatever, as long as you don't address the main issue, para siyang tug of war. Papaputiin mo, iitim ulit siya. Papaputiin mo, iitim ulit siya. So for me, when it comes to your PCOS, talk to your OBGYN about it and work on addressing your main issue or main cause of your pigmentation. And then saka na natin pag-usapan kung ano yung magti-treat dun sa hyperpigmentation mo. Question. Doc, what about Botox resistance or botulinum toxin resistance? Actually, this is a very, very good question. I had the patient yesterday who was asking about it also. In my entire 10 plus years of practice, meron ako na-encounter na 2 patients na hindi talaga sila tinablan ng botulinum toxin injection. And they are virgin patients. And I did my research and it is said that, hindi ko lang maalala yung percentage, pero meron talagang certain percentage of individuals who are unresponsive to botulinum toxin. So meron talaga, but medyo rare siya. What we are starting to experience more now is yung tinatawag na partial resistance to botulinum toxin injection. Kumbaga, kung dati, ang ginagamit mo lang is 20 units, pagbalik mo, parang kulang na siya. Kailangan 30 na. Or, imbes na nag-last siya ng 4 to 5 months, minsan 3 months na lang. So, ano ba yung reason for this? Ang sabi nila, the reason for this daw is injecting too many units at one time and injecting with shorter intervals. Kaya nga sinasabi ko sa mga patients ko, especially yung mga bata na nagpupunta dito in their mid-20s who want preventive botulinum toxin injections. I really don't believe in targeting lines or muscles when they are not there yet. Kasi yung iba parang, Doc, inject mo na yung forehead ko para wag na ako magkaroon ng movement. For me kasi that's not how it works. What we want to prevent are formation of lines, not the movement. So kung wala ka naman movement, I will not inject you. So yun, ang advice ko sa ganyan is only inject when necessary and give a little time or space in between. I don't inject my patients less than 3 months apart. Kasi nga dun talaga nagkakaroon ng ng problema. And we have to remember that apart from aesthetic concerns, botulinum toxin can treat a lot of other conditions that are medical. Like mga dystonias, mga ano pa ba? Basta, maraming pwede. May ginawa akong dyan I guess video about that or maybe it's a lecture. Basta yon, marami siyang other conditions apart from aesthetic concerns that it can treat. Nowadays, may mga dinedevelop na botulinum toxin products who do not have complexing proteins which are said to lessen the risk of resistance from botulinum toxin. Okay, next question. Ay, maganda tong question na to. Doc, I work graveyard shift po. Should I switch my AM/PM routine? To sinabi niya yung routine niya. So actually, magandang question to kasi, like I always tell my patients, your routine should serve a purpose. So, yung pinapahid mo sa skin mo, dapat ma-address niya yung mga gagawin mo for that time of the day. So, ako for example, my morning routine consists of a toner, an antioxidant, moisturizer, and sunscreen. Why antioxidant? Kasi naglalakad lang ako to work, na-expose ako to the environmental elements, na-expose ako sa sun, so kailangan ko ng help in combating these factors. At night naman, my routine consists of sometimes I double cleanse, and then toner, and then serum, and then an anti-aging, and then moisturizer. I put my anti-aging at night because it's at night where your body scavenges for nutrients, dun siya nagre-repair, regenerate, etc. So gusto mo na yung ingredients na gagamitin mo, ganun yung purpose niya para pag nangailangan yung skin mo ng ingredients na yon, may makukunan siya. So kung graveyard shift ka at opposite ka, natutulog ka sa umaga and nag-work ka sa gabi, dapat yung gagamitin mong skincare routine will address your needs for those times of the day. So, pwede mong baliktadin yung skincare routine mo para mag-match siya dun sa kinakailangan ng skin mo. Next, hello doc, meron po akong urticaria kasi mas mataas ASO ko kaysa vitamin D ko. Ano po kaya ang pwede po para gumaling ang urticaria ko? Thank you, doc. Well, actually, urticaria kasi is not a condition per se. Ako, how I explain it kasi, urticaria is, it's like your body's signaling mechanism. Parang sinasabi niya na there is something off or there is something going on in your body that you have to address. So, syempre, iba naman to dun sa mga patients na meron silang physical urticaria or yung tinatawag natin na mga nagre-react yung body to certain conditions like merong heat urticaria, merong cold, and then meron din dermographism yung pag ginaganon mo. But then again, it is a reaction to something that your body doesn't like. So, kung alam mo na pala na mataas yung ASO mo and vitamin D mo and everything, you should discuss this with your doctor who diagnosed you with that. Kasi kung yun yung cause, and alam mo na yun yung cause ng urticaria mo, pag in-address mo siya, mawawala yung urticaria mo. So, ganun siya. Kasi usually for urticaria, we give antihistamines, but it's just a symptomatic treatment. Meaning, habang binibigyan ka ng antihistamine, wala kang urticaria. But when you stop it, and the main cause for your urticaria is still there, babalik ulit siya. So, dun tayo lagi sa main cause. So, talk to your doctor about it and discuss on how you can address your main issues. Last question. Hi, Doc. babalik po ba yung atrophy acne scars na galing sa in-inject na steroid sa pimple? Well, okay. Nangyari na yun sa akin, guys, and nagawa ko yun sa sarili ko. Kasi dati nagkaroon ako ng pimple here, and I injected it with traditional steroid injections. Pero the next day, meron pa siyang konti, so dinagdagan ko. Kinalabasan, after a week or so, lumubog siya. Good news, usually naman bumabalik siya sa dati. Depende na lang on how bad the atrophy that was caused by the injection is. Kasi nakakita na ako ng pasyente na talagang grabe. She was injected, hindi ko na tinanong kung saan, but she was injected repeatedly on her acne. And medyo talaga, sobrang nipis ng skin niya. And meron ng mga broken capillaries. So pag ganyan, medyo mahirap na talaga siyang ibalik doon sa dati. You treat it like an acne scar talaga. Pero yung occasional lang na parang lumubog lang ng konti, like yung nangyari sa akin. What I did, I just had it injected with filler para lang mapuno siya. And ngayon, hindi na siya halata ulit. So, that's why, yung gusto kong i-emphasize talaga dito is, please go to practitioners who are, alam mo yun, experienced na when treating acne lesions. Kasi, it's also dose-dependent eh. Minsan, alam mo yun, nagigigil tayo sa mga acne. So, ang taas ng dose na nilalagay natin. Yung pala, hindi naman pala kailangan na ganun kataas. And then, nasobrahan, kaya lumubog yung skin. So, kung hindi naman ganun kalala yun sa'yo and one time lang siya ginawa, I am very positive that it will go back to normal. It's really repeated injections of high dose of steroids that can actually cause skin atrophy na permanent. So, I hope nasagot ko yung tanong mo, and I think we're done. So, yun. Napakadami kong nasagot na tanong, guys. Thank you for sending your questions. Pasensya na kung hindi namin nasagot lahat. All your questions, concerns are important to us, pero we are limited by time. And syempre, ayoko naman din kayong mabore. So sana yung may mga similar concerns, sana nakatulong tong video na to. And if you have other questions na pwede nating sagutin in this way, like I said, sorry I cannot diagnose and I cannot give treatments talaga this way kasi it's always very personalized. But I can answer general concerns. So kung may mga tanong kayo na ganon, just keep them coming. Kung hindi ko man siya masagot in video format, I try my best naman to answer you guys dun sa comment section. So thank you again for watching, and if you like this video, I invite you to hit the subscribe button and turn on notifications. So see you again next time. Bye!